What's a hairline fracture?
Hairline is just where it's just a thin line where it's more likely that it's going to be non-displaced, right? You could have a spiral fracture that could be hairline, but hairline is just a real thin, where you can just barely see the crack on the bone.
Is there any classification of a crossing a joint or not crossing a joint?
No, not really. I think the main thing is you're talking about epiphyseal.
Okay.
The question is if there's a classification as far as if a fracture crosses a joint. Mostly it'd be like epiphyseal, or if you want to consider if there's disruption of the cartilage. And then obviously if you have a fracture that extends from one bone to the other, it's going to cross the joint. But I don't think as far as terminology that I know of that there's a specific classification. This side is not intact, and then this side is. Okay, you can turn the lights back on, please. So then now we'll talk about the stages that occur when a fracture's healed. Okay, what happens first is just like, say, if you cut your arm, right? What's going to happen? You're going to get a scab formation or a hematoma. So basically, this is just going to lay down blood tissue. Right? Basically, sometimes you just get, when you have an injury or you have inflammation, the body sets up mechanisms where it increases blood supply to that area. A lot of different things go in there. Antibody, things that are going to help your body fight infection. It's going to help laying down the scar tissue. It basically lays down a matrix of tissue that's going to fill in that blank. So the blood, bloodless hemorrhage, and basically you just get a clotted blood, which is hematoma. And then it's going to get swollen and inflamed. So when something initially happens, you break a bone, it's going to get swollen. It's going to get inflamed. Then you're going to have a fibrocartilage callus. So basically it's where you're starting to form a scab. So it's going to be fibrocartilage. You're not going to lay down the bone initially that quick. Then you're going to have new blood vessels that are going to form in there. And then granulation tissue. It's kind of just a mass of tissues that's going to start the framework of where the healing is going to get laid down. It takes time to lay down the different fibers and things as it starts to heal. So first you have granulation tissue, and then you're going to have blood vessels that are going to grow into that, capillaries, things like that. And then also you're going to have phagocytes or phagocytic cells that are going to go in there to try to clean up any of the mess. So as it starts to calm down and things start to get under a little bit of control, then it's going to have time to go in there and clean up the debris.
What happens to the rest of your body when you break a bone? Is there like complications or anything that happens? I've heard people get kind of like physically ill when they break a bone. I've never broken.
Well, in the general sense, when you have, the question is what happens to the rest of your body when you break a bone? I mean, you go into reactions to any type of injury. Yeah, you're going to have endorphins and different body things that are going to be secreted through the body. There's nothing specific related to bones that is going to happen in the rest of the body. I mean, you can have different things where you have a severe enough injury, you're going to go into an anaphylactic shock, or if somebody loses enough blood, things are going to happen. But basically a bone break versus a sprain, strain, any type of injury, there's no specific types of things. I mean, obviously, you might, when you talk about fracturing the vertebra and it starts getting close to the spinal cord, then you can go into spinal shock, which is a whole other type of thing. There's certain complications that can result from certain types of fractures where maybe it might throw a blood clot or something like that. Or there can be vascular injuries of blood. Like talk about maybe things in the elbow or something like that. Bones can get separated or broken where you have an injury to blood vessels. And then that's going to cause other either bleeding, or if it's a long-term type of thing, you can have decrease of blood flow where you can get, I don't think we'll cover that in this class, but you can have different like Wolfman's contracture or something like that, where the arm will contract into certain contorted positions based on muscles that contract as a result of loss of blood supply. So those are more complications that occur down the line rather than right at the time of the initial trauma. All right, so where are we at here? So then osteoblasts and fibroblasts. Remember, anything that ends in the blast, those are the immature types of things. Osteoblasts are going to be laying down bone. Fibroblasts are things going to lay down fibrous tissue. And it's going to start, it's like when you're building a skyscraper, right? You put the structure in, you put the beams in and things like that. So it's going to lay down some fibers that are going to be sort of the base, the framework of the rest of the healing process. And the fibroblasts are going to secrete collagen, and that's going to try to connect the broken bones. So like I say, you're trying to just go in and lay down some framework to try to get things back together. And then osteoblasts are going to start to form spongy bone. So the spongy bone is going to form first. And after about, on a fracture, let's say, if you take an x-ray of someone that you suspect maybe they have a fracture and you take it, the same day, and you don't see any fracture, it might be that it's such a small hairline fracture that you're not going to see anything. You wait about a week to 10 days, and you're going to see like a callus formation, where you look on an x-ray, and you'll see kind of something like that, where it's sort of, the bone is sort of enlarged. So basically what that's doing is that basically your body forms a rough patch on that area, and then later on, the different osteoclasts are going to go down and go in and sort of break that down, and eventually it will start to look back more like normal bone. So that's why on certain, like especially if you talk about navicular, anytime somebody has we call it foosh, F-O-O-S-H, is falling on an outstretched hand. Somebody that falls on an outstretched hand, you assume that they have a navicular fracture until proven otherwise. So you're more likely going to be casting them because of the chances of the avascular necrosis. And so you may take an x-ray initially, then you may take another one later, and you may see a callus formation. And then basically the osteoblasts farthest away, they're going to secrete a matrix that's going to later calcify. So it's basically, you're forming a scab, and then that scab is going to turn into bone. So then you get this bony callus of the spongy bone part starts to form. So you're going to have the trabeculae in the fibrocartilage. And then eventually it's going to start converting into bone, and then it's going to start working its way back into compact bone. So it starts as a spongy bone, and then it's going to fill in and get all the architecture. So it's like if you first build a skyscraper, you put the main beams in, and then you do all the finished work with the walls and the plaster and the light switches and all that stuff. So it's going to be about 3 to 4 weeks, and then you're going to get a firm union within 2 to 3 months. So usually, with you get a cast put on, it's going to be 6 to 8 weeks, depending on what type of fracture, what area of the body it is. And then, like I mentioned, the bone gradually is going to remodel, and it's able to pretty much remodel itself and build it back up just like regular bone that it was in the beginning. Whereas if you're talking about ligaments and tendons, they don't quite remodel to the same extent. So then when you get to the point where you're putting it back to compact bone, where you have the osteons or the Haversian canals with all those different things, the lacunae, the canaliculi, and all that stuff.